Assalamu alaikum. We are going to start the skull now for the neuroanatomy. This is a skull, and as we can see that the skull is the structure that is going to help protect the brain, and it also has many important functions. When we study the skull, we study it from the exterior. This is the vault of the skull, and this is the internal structure or the fossas, and these are the normas that we see on the exterior of the skull. Many bones are present in the skull. This is the frontal bone. On the calvaria, this is the frontal bone forming the coronal suture with the parietal bones, and after the parietal bone, posteriorly is the occipital bone. Here is the occipital bone. After that, there are lateral bones, which is the temporal bone and different parts of the temporal bone, the sphenoid bone, and in the front there is a major part of the skull which has many bones. We will talk about them later. So when we study the skull, we study its anatomical position. The anatomical position of the skull is described by two lines. A Reed's line, which is a horizontal line, which is obtained by joining the inferior margin of the infraorbital margin to the center of the external acoustic meatus. This is the external acoustic meatus, this is the orbit and the infraorbital margin. So this is the line which passes through the center of the external acoustic meatus is the Reed's line. The Frankfurter's horizontal plane is oriented by obtaining the line joining the infraorbital margin to the upper margin of the external acoustic meatus. They are just like a few centimeters apart, and this then becomes the anatomical position of the skull. So we have to keep them in this horizontal plane. Then we can study the calvaria or the vault of the skull, and as we are concerned with the neuroanatomy, we are going to see the interior or the base of the skull. What we can see is that this is the base of the skull, which is the part where the brain rests, and this is the vault of the skull, the projected part over which the scalp and hair are present. If we see the interior of the vault, what we can see is there are some impressions, there are some elongated vesicular impressions, there are some pits that are present in this part. So what we can see is that these features are more prominent that on the interior side. How we will determine if it's in the interior side or not? This is the coronal suture, which is present anteriorly, and this is the lambdoid suture. So this part is the anterior part. In the interior of the anterior part, in the midline, is the anterior frontal crest, which lies anteriorly in the median plane, and it is projected backwards. This frontal crest is continuous on the frontal bone in the skull as well. Alright, and other thing is that the bones of the skull are diploid. That is that they have the compact bones on the sides with the spongy bone in the center. So this diploic bone on the interior table or the inner table has these projections. So the first projection was the frontal crest. Then behind the frontal crest there is a sulcus that is present along the length of the skull. This sulcus is called the sagittal sulcus, which lodges the superior sagittal sinus. Along this sulcus there are numerous pits that are present near the on the both sides of the sulcus. These pits are called granular foveoli. These are deep irregular pits that are situated on the sides of the sagittal sulcus, and they are formed by the arachnoid granulations. We are going to talk about that when we study the neuroanatomy. After that, what we can see is that there are some impressions of the vessels. So this is the coronal suture, almost a centimeter behind the coronal suture. This is the coronal suture. Almost a centimeter behind the coronal suture is the vesicular marking for the anterior branch of the middle meningeal artery. We can appreciate it very well. This is the anterior branch of the middle meningeal artery on both sides, and then we can also see some of its branching as well. All of the parietal bone, this is the parietal bone, all of the parietal bone has these markings of the vessels on it. After that, what we can see is that there are some parietal foramina. These parietal foramina on the exterior of the skull are present 2.5 or 3 centimeters above the lambdoid suture. These foramina open onto the interior of the skull here. So they open onto the interior of the skull as well. The impressions for the cerebral gyri are also visible, but they are not appreciable in all the specimens. Sometimes they are appreciable and sometimes they are not. So these are the bones. The anteriorly it is the frontal bone. If we look at it from the exterior, this is the frontal bone. These are the two parietal bones, and this is the occipital bones. These four bones collectively form the interior of the skull.